Health authorities around the world are stepping up efforts to contain a possible spread of hantavirus after 2 new suspected cases were reported far from the luxury cruise ship where the outbreak began. The latest cases involve a British man on the remote South Atlantic island of Tristan da Cunha and a 32-year-old woman in Spain who had briefly sat near an infected passenger on a flight from St. Helena to Johannesburg. The new reports are separate from the outbreak aboard the Dutch-flagged cruise ship Hantavirus, where the World Health Organization says 8 people fell ill. 6 of those cases have now been confirmed as hantavirus, and 3 people have died. Hantavirus is typically spread through contact with infected rodents. However, the strain identified in this outbreak is the Andes virus, the only known type that can be transmitted between humans through close and prolonged contact. Despite the developments, the WHO says the risk to the wider public remains low, noting that the virus does not spread easily. The Hantavirus, operated by Oceanwide Expeditions, was carrying 147 passengers and crew on an Antarctic expedition that began in Argentina in March. The ship is now heading to Tenerife in Spain's Canary Islands, where passengers will be screened before disembarking. Oceanwide says no one currently on board is showing symptoms. Health agencies in several countries, including the United States, Britain, Spain, and Singapore, are tracing passengers and monitoring contacts. The U.S. Centers for Disease Control and Prevention has arranged for American passengers to be flown to Nebraska, where they will undergo precautionary quarantine and monitoring. The outbreak has raised concerns about how infectious diseases can spread across continents through international travel, even as health officials stress that the chances of wider transmission remain low.